the audience from August 15 to 20th, all localities in Tay Ninh province carried out screening tests throughout the province. This is considered the current key solution for the anti-epidemic work in Tay Ninh to quickly detect and isolate F0 cases from the community, cut off the source of infection in the province, ensure and expand the safe green zone. Up to now, the screening tests were carried out safely and effectively by localities.
With the goal of quickly detecting and separating F1 cases from the community, cutting off the source of infection in the province, after the results could be available, it has been necessary to immediately determine the epidemic level of each locality in order to take appropriate management measures. In the spirit, if it is a green zone, there should be a plan to protect, keep it safe, quickly shift the orange and yellow areas to the green areas. For the red zones, it must be managed, cleaned, and closely monitored to prevent the epidemic from spreading to other areas. Taking advantage of the time when Tay Ninh is continuing to implement social distancing, according to Directive number 16, localities focus on implementing COVID-19 screening tests for people in area in which, based on the actual situation, that the localities can recite the general plan of the Provincial People's Committee. It is important to strengthen the propaganda to the people about the purpose and necessity of the screening in the community, creating consensus and positivity of the people.
Trước khi thực hiện thì đã chỉ đạo cho hệ thống các cái cơ quan
Before
truyền thông,
implementation, we
đài
directed
truyền
the
thanh,
system of media
ban
agencies,
tuyên giáo
radio
thì
stations,
triển khai trên hệ thống
propaganda,
cộng tác
and
viên của
training
xã hội, tuyên truyền
departments
viên, báo
to
cáo
deploy
viên.
on social
Ủy
networks.
ban nhân dân xã
The
phường thì
system of
dùng loa di động
propagandists and
để
reporters,
tuyên truyền
the
cảnh số
people's
mặt khu phố
committees
về
of
cái
communes and wards to
thời gian
propagate to
lấy mẫu
hamlets
của
and
từng địa
quarters
phương cụ thể,
about the specific time to
để
take
người dân
samples
biết được
for
cái
testing
thời
so
gian
that
mà
people
mình
know the
đến cái
time and
nơi lấy
place,
mẫu đảm bảo
ensuring
không có
that
tập trung đông người.
it did not gather in large
Quá
numbers
trình
during
triển khai
sampling.
thì
The
đã phối
implementation
hợp cùng với
process were
các
coordinated
cái
with
tình nguyện
volunteers
viên
in Hoa Thanh
phân công thành
area,
các tổ.
with
Hiện nay trên địa
15
bàn Hòa
sampling
Thành thì có
teams, and
15
was
tổ
carried
lấy
out
mẫu
in the rolling form for
và
each commune
sẽ
and
thực
ward.
hiện theo hình thức cuốn chiếu từng xã phường.
Thanks to the good implementation of propaganda and announcement of specific dates, times, and locations to people to take sample, the number of people coming to the sampling points for screening tests was guaranteed. Meanwhile, the epidemic prevention control was also strictly implemented. I see that this is very meaningful because it helps screening and test the infected cases to isolation as soon as possible. With a large-scale fast implementation time, returning results within 36 hours after sampling and not affecting the lives and activities of people, localities also focus on mobilizing maximum monetary resources, participating in sampling for testing. Armed forces were trained before participating in sampling, except for medical staff who directly took samples. There were also volunteers who coordinated people to nearby empty testing points to avoid long waits and large crowds. At the same time, the functional forces also set up checkpoints, stations, and patrol teams in the areas, strictly managing for 36 hours from the time of sampling until the test results could be available. People were only allowed to travel in the case of necessities. The locality was also supported by the city with 120 jobs. Meanwhile, the city health center also supported the work with 30 volunteers who had been trained in sampling. On water gas had been mobilized, assigned to points to guide people and maintain security and order. The youth union force guided people to install pollution application, make medical declarations, etc. The veterans union was assigned to keep the post in the world, while the women's union and the farmers union took care of the people in terms of food. Except for taking samples for screening tests, localities had reviewed their needs and made specific plans to support people with food and other essential needs during the 36-hour blockade to wait for screening results. Besides, for the scattered residential areas or areas with F1 cases, which are implementing blockade, many localities also carried out sampling for testing at home, creating convenience for people to ensure safety in the epidemic prevention control. For very high risk and high risk areas, the aggregate real-time PCR test will be performed.
Chúng tôi sẽ làm từng cái vùng đỏ,
We
cái vùng cam
started
trước.
taking
Sau
samples
đó khi
from the
mà
red
xét
and
nghiệm xong
orange area
là chúng tôi
first.
chốt
Then
chặn
we established
triệt để
100%
100% để thực hiện
checkpoints
theo
following
chỉ
the
thị 16
directive number
để chúng
16
ta
to
sau
cut
đó
the
thì chúng ta mới
F0
cắt được
chain.
cái chuỗi.
Goyo's
Và cái quyết tâm
determination
chung
is to
của Đảng
work
bộ và
from
dầu thì
yellow
chúng tôi
area
làm
to green
từ
one,
cái
from
vùng
orange to
vùng
yellow
vùng vàng
area,
rồi nó
from red to
xuống vùng xanh,
orange area,
từ cái vùng cam
gradually
rồi xuống vùng
pushing
vàng,
back the
và từ cái
epidemic.
vùng đỏ là
We
xuống cái vùng
started
cam,
at 7
từng bước là phải
o'clock
sót
and we
7
took a
giờ chúng
break
tôi bắt đầu
until we
làm
finished. It
khi kết thúc
didn't
lúc
finish
nào
during the
là chúng tôi mới
daytime.
nghỉ thôi,
We
chứ
work at
nếu
night,
không
determined
làm
to
ban ngày thì phải
finish
làm
it.
kể cả ban đêm luôn, là phải quyết tâm làm cho nó xong.
Through the implementation of screening tests, many people were guided by volunteers to install the Blue Zone application simultaneously. When sampling results would be available, the areas would establish green zones if no F0 cases would be detected. If F0 would be detected, the locality would take measures to blockade, isolate, trace F0, clean the area to soon become a green zone.
Ladies and gentlemen, currently the functional agencies are making efforts to control the epidemic in the province with the goal of bringing people's life back to a new normal state soon. Each citizen also needs to join hands and accompany the locality in the pandemic prevent and control tasks, especially comply with local instructions and notices. Do not leave the house during the implementation of Directive number 16 of the Prime Minister. And that's all for today's program. Thanks for your attention and goodbye for now.